At Varian, our mission is to create a world without fear of cancer. And we take this very, very seriously. When we think about our digital solutions and how they can impact patients, I look at things probably in several ways, and I'm going to summarize about four of them. That really is the center of our work for digital oncology. Number one, first and foremost, and our core principle is to prioritize patient-centric care, which really means integrating clinical information and insights. So if you think about the clinical information as well as patient reported information across their care journey. To this end, we have been creating a unified software ecosystem for oncology. So what this means is a single workspace that brings together all the valuable data and provides greater visibility so that essential patient information is always accessible at the point of care for the clinicians. Number two in this journey really is about integration. So what we want to do is ensure integration for the various data sources that house patient data, really to try and give the most comprehensive patient view. So what we're doing is we're enhancing interoperability and sharing relevant data with large electronic medical records. So these are the systems that house most patient information in health systems or hospitals. We want to ensure that we're sharing the oncology specific data in those sources of truth. And what this does is it facilitates seamless communication between Varian's oncology systems and then the broader healthcare network to support informed and efficient decision-making for our patients. Number three is innovating with speed. Perhaps, you think about patients today, they're used to digital, a lot of them are used to digital tools, and they expect healthcare technology to evolve really at that same pace as the other technology that they use. So we're working very hard toward innovating at that speed. So we're continually building impactful features, capabilities to meet the needs of cancer patients and clinics to ensure that solutions really are relevant, they're responsive, and most important, effective in helping our clinicians treat cancer patients. And last, I would say, is really about connection, right? Our digital solutions are allowing patients to stay really truly connected to their care teams in real time. So this is very reassuring, right? So that they know that someone is on the end of that application and that their care team is really looking at the holistic view of their health to really help deliver timely and personalized care to treat their cancer. Thought about this one, and I think I'm going to answer the details really surrounding a very specific tool that Varian is able to provide patients, and that is our patient engagement application called Nuna. With Nuna, cancer teams can engage with their patients directly through an application throughout their journey, and really it's about so much more than just appointments and results. This application allows patients to send real-time symptom reports directly to their clinicians. They can respond to quality of life questionnaires. They can keep a personal journal. Nuna is really helping the care team support the patient beyond just the symptoms of their disease. It gives them a safe space to share their personal experience throughout their cancer journey. So if you think about it, it's a tool to really help the whole patient and not just the disease. Additionally, when you face cancer, having information really right at your fingertips is vital. So therefore, educating patients on what to expect and when to reach out to their physicians and clinicians is very, very important. And Nuna offers that ability. So they're able not only to reach out, but to have that information or that education directly at their fingertips in a digital format that is kind of stored in one location in their app so that they always know where the information is and that they can review it when they're thinking about something, when their family is thinking about something, or they have a question that they need to really kind of just check with the application to see what's going on in that part of their journey. See that, at Varian, through this Nuna application and our other digital tools, we believe that by understanding patients' needs and giving them the tools, what we're doing is we're making them an active participant to the decision-making process throughout their care journey, right? So this technology actually can play a significant role as an enabler to standardize and automate this process at scale for every patient that visits the clinic. So this is a really important question because I believe standardization in measurement is very clear and very important because we need to see exactly of all these interactions and all of these tools and the digital solutions that we provide, are they giving us the outcomes that we need, or actually helping the physicians and clinicians give the outcomes that we so desire. At Varian in digital oncology, our focus for the next year really is about bringing more integration of these solutions to the care teams, right? That's how you kind of start that process of standardization, is by integrating all the different tools that our clinicians need to use in order to treat these cancer patients. And by doing that, if you have this integration of the digital suite, it really is integrating the data, right? Which is so very important for measuring outcomes. So, we're also working hard, really not just to allow clinics to gather information, but how do they analyze it, right? So how do they analyze the information that's coming in, whether it's from digital tools, whether it's from outside sources, whether it's from this very important patient data, to ensure that the optimum care really is being given? And if not, how can we help improve the treatments to further reduce, whether it's side effects, whether it's improving outcomes, or just that connection that the patient feels with the clinic? How standardization kind of plays into this, I'll go back to NUNA, right? So if we're thinking about the patient side of this and how they're impacting their decision-making within their cancer journey. Within NUNA, within that application, we have an extensive library of standardized questionnaires that monitor oncology and hematology patients through treatment and beyond, right? So there's really an ability to give these standardized tools at even time slots along the way. So we have specific scheduling templates so that we can ensure, again, standardizing when we send these questionnaires to the patients, so that we can ensure that when we're collecting these data, they're at the same time points along that cancer journey. And we can even do this, kind of pushing these at relevant to the relevant patients at the relevant time based on their disease, as recommended by ISHAM, should they choose. We also provide the solution, the NUNA solution or the NUNA application, in several languages, right? This is very important because, patients, not just obviously we want to be able to ensure that they can interact with the application, but it allows them to input data within their own native language in the exact field so that we can standardize in the background across all of the language. So obviously, also very, very important. And then finally, it's really important to remember that, not every patient is as tech savvy as the other, right? We have patients in all age groups, some, much more able to use technology, some might need a little help. We also have patients that may not have access to, whether it's a mobile device or a computer, and we cannot neglect these patient groups, right? We need to ensure that we have this information collected from all of these patients in that same structured format. So we also provide the ability for others to implement or to answer these questionnaires or to answer the NUNA information for the patient. So whether that's a family member that can help the patient filling out these information, or just allowing the patient to do it once they come into the clinic. So sitting down with the nurse or sitting down in the waiting room and being able to have that tool so that we can collect the information in the structured format. So really, if you think about all of these, this is how we contribute to the standardization of these measurements on the way to standardizing what we're seeing as the information coming towards outcomes. Really what we appreciate is the opportunity to connect with audiences outside of radiotherapy. You touch many more groups. Varian is very well solidified within the radiotherapy community, but we're here to learn from innovators across health sectors. Cancer is a very broad disease. It takes many specialists and many fields to treat that whole patient. And really, it's about thanking you guys for bringing us all together to see what we can do to bring a positive impact to cancer care and really patient care in general. Varian truly believes in value-based healthcare globally, and we really just love coming together as a larger community under one goal and one purpose, and that's keeping the patients at the center of everything that we do.